So you're applying to dental hygiene and therapy, a really competitive course to get into, sometimes even more competitive than dentistry, but it's a career that I highly recommend to a lot of people, and I've helped over 100 people to break into this. And I say the most important thing is applying with a strategy. Don't just apply and leave it to chance. A lot of people do that and then they end up getting rejected, and they take a gap year and then they apply again, and then they end up going into a completely different career because they give up. What I would say is invest in career support, invest in guidance, and that means investing your time, maybe money, and that can really help significantly improve your chances of getting in. Your time is the most valuable thing that you can put into this application. I mean, actively contributing. There are specific things that admission teams are looking for from their applicants. Things like really good communication skills, empathy, manual dexterity. They don't want to see any signs of red flags, and I'll make a separate video on what the red flags are when you're doing these sorts of applications. What they want to see is firstly things like shadowing. Shadowing is integral to your application. If you're a dental nurse, you're already going to have experience in a dental clinic. That could be over the course of months or even years, which is amazing. If you're a BTEC A-level student, for example, you're not going to have that experience, and shadowing is absolutely essential to show that you understand the profession, the challenges that come with it. There's ways that you can do virtual shadowing, but what I'd really recommend is in-person shadowing, because that can make you stand out. Some universities also have a really strong preference where they'll say 1 week of shadowing as a minimum. That could be something that completely rules out your application if you've not arranged that. One way to get that is contacting local dental clinics. Orthodontic clinics also sometimes have a hygienist, or contacting dental hospitals, dental universities. You could even contact the dental hygienist that you maybe see on TikTok or Instagram, and if they're local to you, see if they're open to letting you shadow for a few days. Contact dental clinics, email the practice managers, and see what you can arrange. Shadowing is absolutely critical. If you can't get shadowing, see if you can get some virtual shadowing. I believe SpringPod does some virtual dental experience, and you need to also read a lot about the profession. Show that you know it inside out. You understand that it's rewarding but also challenging. That's really important. Another thing that I have seen from multiple applications is the power of volunteering. Volunteering is one of those things that looks so good on your application. Sounds really good when you talk about it in an interview. It's something that would have built your skills directly. Whether you're a dental nurse or a student who's at college or sixth form, this is one of those things that's really going to make your application stand out. If you're a dental nurse, some of you think that volunteering isn't essential, but it could be one of those things that gets you that extra couple of marks that lands you an interview. You need to apply strategically, so get as much exposure and experience as you can. Volunteering as a dental nurse could look like maybe going into schools to deliver oral health presentations. It could be working in the community, helping the homeless. It could even be volunteering in a care home, volunteering with kids, something that shows that you've worked with a group of people, maybe of all different ages, vulnerable patients. That's really, really important, because those are the skills that you're going to mention in your personal statement. You can't just say, I have good communication skills. That needs to be backed up with real evidence and examples, and those examples are either going to come from a job or it could be from the volunteering. Okay, another thing that makes a really, really big difference is doing something that shows commitment. So volunteering is a really great way to demonstrate commitment. It's committing to patient care or resident care over a period of time. It's not just something you've gone in to do for a day. It's something that you would have done continuously over the period of weeks and months, and that shows resilience. Another thing is doing something to build your manual dexterity. This isn't something that you can start to do the day before the interview. It could be a hobby like sewing, crocheting. Some people even crochet something and then show that during the interview. It's a skill that you're going to build over time. Some people have done things like painting, DIY. If you're a dental nurse, you would have built your dexterity through mixing materials. It's a skill that you need to show. It could be henna art, it could be makeup art. And even if you're doing a multiple mini interview, they could even test that. There could be a manual dexterity task where they're actually seeing your hand-eye coordination, especially under pressure. It's a skill that you need to have, good coordination. So essentially what you're doing is building skills that they look for in future dental professionals, whether that's dentistry, dental hygiene or therapy. These are skills that are really important. Even things like empathy, being able to show compassion. The only way you can show empathy is through real examples of working with people, speaking to vulnerable groups, speaking to vulnerable individuals. Take initiative, whatever initiative that is. If it's maybe doing something extra in the clinic where you're helping, supporting, maybe you're a lead dental nurse, or maybe you're a trainee dental nurse, but you've identified an issue in the clinics and you're taking lead to maybe change something. Or if you're a student, maybe being a prefect, or doing something where you're contributing to change, you're building your leadership skills, your collaboration skills, you're working as part of a team, because that is what dental hygienists and therapists do day in, day out. So first, you're going to arrange shadowing. Second thing you're going to do is start building your skill set. Third thing that's really important is check the entry requirements of the universities that you're applying to. The number of times I've seen people get rejected straight off the bat without even being offered an interview because they didn't meet the entry requirements. This is something that's so simple to check by going onto the university website, scrolling down to entry requirements, and comparing that to the grades you have, whether they're predicted grades or final grades. There are some universities that sometimes will slightly overlook if you're not exactly meeting the grade requirements, but that's a risky option. I would say ideally you want 4 options that are solid where you do meet the requirements. Now look back, if you've applied previously and you were rejected before you even landed an interview, there was one of 2 things that could have happened. First thing, personal statement is not strong enough, you're not being shortlisted. Second thing is that maybe you've not met the entry requirements. If you're not sure about your grade requirements or you have an unusual situation, you can email the university, get it in writing, find out, get someone from the university to check whether you meet the requirements. All of this takes time, it takes effort. So investing that time can be really valuable to do from the beginning. It's all about applying with a strategy. Now, if you don't want to do the research, or you'd rather pay someone to do the research, maybe you've got kids, you work full time, you just don't have the time, you can invest in a strategy call with me where I'll work with you one-to-one. I'll do the research on your behalf, looking at the universities. I'll compile a list of definite universities, maybes, ones where you'll definitely get rejected, and then go from there. I also know how interviews are conducted at various universities, so I can advise on which interviews would be the easiest for you, and we can come up with a tailored plan. Okay, so you're going to arrange shadowing, you're going to arrange volunteering, and you're going to be very thorough with checking the entry requirements. And if you're not sure, you're going to be contacting the universities. I would say take your college advisors or maybe your tutor's advice with a pinch of salt. If they've not helped people break into hygiene and therapy before, or maybe they've only helped maybe 1 or 2 students, they might not have the best advice. I say this from somebody who went to a state school, went to a 6th form, where they didn't really help many people get into dentistry or medicine or courses like that. And I look back to all of the advice that I was given, and actually a lot of the advice was really poor advice, not relevant, and the interview mocks that they did with me completely irrelevant to the real interviews I had on the day. What I would say is just take their advice with a pinch of salt and maybe do the research yourself. There are resources to help you in the description. I've also got other videos with lots of free advice that you can watch, look into, and start preparing. What I would say is apply early. A lot of universities have a rolling deadline, and sometimes they say they'll give equal consideration whether you apply early or later. What I have seen time and time again is people who apply early get interviews early and they get offers early. If you imagine a university has a set number of offers, for example, they're going to give 80 offers. People have already started receiving offers in November, and maybe by the beginning of January, already 30, 40 offers have been given out. Do you think they're still going to equally consider the rest of the applicants, or are they going to have to be more and more picky when they've already given out offers? I can't say for sure. I don't know. It probably varies based on the university. Why take a chance? Just be ready, be prepared, and apply early. If there's a situation where maybe you can't arrange shadowing until November, or you can't arrange volunteering until end of November, December, in that case, volunteering and shadowing would be integral to your application. So in that case, I would wait a bit longer. And I've had a lot of people apply in January, and I still managed to help them to get interviews and offers. Let's just recap those things. You're going to do shadowing, you're going to do volunteering, you're going to take initiative, take time to actually do things which show that you're building your skill set in preparation for the course. You're going to read about the profession, the rewarding sides, the challenging sides, and you're going to understand it inside out, because that's going to be really helpful later. You're going to do thorough research yourself. You're going to make a list of schools that definitely accept you, and you're going to apply to those ones, and you're going to try your best to apply early. I think those are the most helpful things that I can give to you right now, but there are going to be more videos coming out regarding interview advice, do's and don'ts, and red flags in your application. Comment if you need further information, and do let me know if these videos are helpful so I can keep making more of them. Make sure you're subscribed so you're not missing any future videos. If you're interested in any other career paths, do let me know, and I'd love to be able to make some videos on that.